Good morning, everybody. Today I will explain my protocols to fix a case of a class 1 malocclusion with a severe deep bite. My patient had a normal incisal display and labial competence, while intraoral records show buccal corridors, a steep curve of span, and a retroclined position of upper incisors. X-rays analyze reveals an hyperdivergent skeletal pattern and a normal lower incisor angle. I planned only one set of aligners to fix this case, and total treatment time was 11 months. First of all, I wrote to my technician to decrease the overbite via anterior intrusion only. In this case, give at first a lateral positive torque and then go for anterior proclination. Start the anterior intrusion only when the crowns of incisors achieve their final position on the sagittal plane, because incisors, in order to be intruded, cannot be retroclined. Finally, overtreat the anterior intrusion and the anterior proclination. About attachment design, apply traditional horizontal attachments instead of power ridges on upper centrals to keep the aligners fully engaged on the teeth. Please don't forget bite ramps on the palatal surface of upper canines to avoid bite block effect and help the posterior extrusion. In the lower arch, we have to level the curve of spec to avoid anterior occlusal contacts at the end of the treatment. The right sequence of movements is procline lower incisors until the labial surface is perpendicular to the bone. Make interproximal reduction to soften contact points. Once the roots have been removed from the cortical bone, apply an anterior absolute intrusion, and finally retrude lower incisors, adding lingual rotor simultaneously. Remember to apply support attachments on lower premolars to provide anchorage for anterior intrusion. Leveling the curve of Wilson creates a relative posterior extrusion that will help the correction of the deep bite. Look at these after images, and we've achieved the deep bite resolution via anterior intrusion only. Intraoral final records show the expansion of both arches, and crowding was solved by proclination of upper and lower incisors. Finally, this is before-after comparison. For further tips, join us on Smart Aligner Service.